The electrodes are kept with their caps on, and there is fluid that is left in the caps in order to make sure that the membranes don't dry out. So the first step at the back is to turn on the machine and to ensure that all 4 electrode plugs are in place. You'll notice that there are 2 USB slots. The upper or first USB slot is used both to load an image of the wound and sites, as well as to download the report once that has been completed. So at this stage, the TCOM should have started up, and then the first step is to take the electrodes, remove the cap, place them in the docking station, and swivel it so that they're secure in position. So we're going to do that with each one of the 4 electrodes. Here we go. And the last one. You'll notice that on the screen it shows that all of the electrodes are checked and ready for calibration. And here it says calibration button. So you now push this button, and what will happen, you may notice the temperature of the electrode starts increasing, and it will heat up to 45 degrees. And as it does, the measured oxygen, which is from the environment, will also change up to a value of 157. Once it's at that level, the electrode will be tested for any deviation, and if it deviates more than 2 millimeters mercury, then it will be rejected and the electrode needs to be recalibrated. So this process usually lasts about 2 minutes. While we're waiting for it to calibrate, the menu is rarely used. Mostly we work between main, which is this, the patient's information, the sites that are selected, and ultimately the report that is generated. So this is the camera that we use to take images from the sites so that we can then allocate the electrode positions. Turn the camera on there. The camera doesn't have a flash drive inside. It just uses the mass memory of the device. And you'll take a picture of the wound, and then the camera needs to be connected to a cable. And as I mentioned, it needs to be put in that first slot at the back of the machine. What will happen now is the camera will close, and you hear whip, which means that the camera has been recognized. In the meantime, the calibration has completed and all 4 sensors have been calibrated okay. So I'll just show you how the camera works. You can see the icon. This is the site selection. I just took an image of a chair here, so obviously we would use a patient in the real setting. And then what you are able to do is you can literally drag the image from there to whatever the site is that you're measuring. So you put your hand on that icon of the finger, index finger, and you can move the various sites. We usually have classic labels, first and fourth web space or posterior gastrocnemius. They can be entered, but otherwise the numbers are sufficient to be able to identify where the measurements were done. So at this stage, we're going to now enter the patient's information. The first name is obvious, the family name follows, and the identity is the CPR number that we would typically enter. So I'm just going to make up a name for now and just make it John Doe. With a non-specific number. And then we create that individual. The date of birth, we're just going to choose an arbitrary date. January 2nd, 1970. The gender of the patient, which you just toggle. If you place your finger on the blue button, it toggles between the options. So we'll leave that as male. And then you go to the next screen. This oxygen saturation is determined by putting a pulse oximeter on the finger. We'll just say it's 95. We always use the semi-Fowler's position. In other words, the patient has their legs horizontal and their upper torso at 45 degrees. Many of the patients are diabetics. Some of them are smokers. And then all that remains is whether there is swelling in either of the feet. So that may or may not be the case. What follows is a column where you can add notes, but we rarely use this because we add the information to the report. So at this point, we have the patient's wounds identified and marked in terms of the electrode sites. And now we know that the electrodes are calibrated, and this play button is the one that starts the test. It will prompt you, and mostly we use the top one, which is a transcutaneous oximetry outside of the hyperbaric chamber. The second one is only used if the TCOM is done inside the hyperbaric chamber. So we push TCOM there, and then it prompts you to put the electrodes in the various rings. So what will happen in the meantime is that you will have prepared the site that you are going to place the electrode on the patient, and we're going to show you that with a separate video. The electrode is locked in, and once all the electrodes are in place, you hit the OK button and the process will continue, and it will measure for 15 minutes on air, prompt you to then put the patient on 100% oxygen, and it will then count another 15 minutes. So we have a 15-minute air value and a 15-minute normobaric oxygen value that we can derive from this particular configuration. All right.
If they are air, you remove them. Take this one. I'm going to use this foot. Pick a spot. First web space. Clear. Web call. Remove small bits of skin that's still there and remove the stickiness of the cellotape. Ringlet. It's got a little tag on. Take the tag. Pull the skin. If there are wrinkles, pull the skin tight. Put it between the tendons. Press on it to make sure that the inside of the ring is stuck on the skin, and then rub it around to make sure that there are no air coming through. It must be closed off completely. We're going to use purple one in a moment. Contact fluid, 3 to 4 drops. 1, 2, 3, 4. Purple one off. Tag, start from this side across the halfway side of the tag and turn it clockwise until it sticks. Make sure that it's closed there, that there are no air gaps. And from there, you start to rest. which I'm not going to do immediately, to see how the level eventually drops and then picks up again.